Causes of disease. Different concepts can cause different concepts that cause from a biomedical model, and concern is not what X caused Y. Concern is what is the relationship between X and Y. Then the precipitating factor is woven into the pattern. A pattern is a temporary synthesis that is tested in the treatment process. Now, we have here Eastern and Western logic. In Western logic, A should always equal to A, meaning A cannot be not A or B. A does not equal B. So, but in Eastern logic, A may or may not equal to A, meaning A can be not A or B. A does equal to B. Okay? Now, this logic way of thinking influences cultural, political, and scientific thought in each culture. Cause in PCM is part of the assessment, but it quickly becomes part of the landscape or pattern. Cause and effect are not linear, but a circle. Precipitating factors or causes of disease are environment, emotional, lifestyle, and heredity. Environmental causes of imbalance. We have 6 pernicious influences. Wind, cold, heat, fire, dampness, dryness, and summer heat. Climatic factors are manifested in people, not much different than the climate. So what makes this possible? Pernicious influences are internal and we have also external. In internal, long-term illness or it is a chronic disease. Constitutional patterns, the yin and yang balance has been disrupted and make up the focus of modern practice of PCM. In external pernicious influences, there is exposure come from the outside. So can only penetrate if they are very strong as in excess, and or the body's chi is low as in deficiency. Okay? Now it includes bacteria, viruses, and others, characterized by sudden onset, and then treatment aimed at releasing the exterior to prevent penetration to the interior. Then releasing the exterior and tonifying the upright chi. Now let's go to wind, a young phenomenon. It affects the body just as it moves the branches of a tree. Now there is a comparison between external and internal. In external, it often combines with cold, heat, and damp. It is a sudden onset, often fever. First appears in the upper body, like in the face, head, nose, hands, skin, lungs. It resembles biomedical infections or contagious diseases. Symptoms have characteristics of the accompanying PI, often consequence of vacuity of chi. Now, sa external naman, chi of distorted movement. So there is tremors, shaking, convulsion, paralysis, dyskinetics, things move, come and go, dizziness, gas, tinnitus, anger, explosive, suspicious, or assertive. It resonates with the liver, quick onset, even internally generated, and is often consequence of vacuity of blood. So dito sa external, it is a vacuity of chi, while sa internal, it often consequence of vacuity of blood.